Thank you so much for sharing your perspective. I would now like to welcome our third speaker of the night, Dr. Alsan. Dr. Alsan is a professor of public policy at Harvard Kennedy School who works as a physician economist focusing on health inequality. She graduated from Harvard University with an undergraduate degree in cognitive neuroscience and later earned a master's in public health from Harvard, a medical degree from Loyola University, and a PhD in economics from Harvard University. She did a clinical infectious disease fellowship at the Massachusetts General Hospital and has returned to the Harvard community after serving on faculty at Stanford. She founded the Health Inequality Lab at the Harvard Kennedy School, where she studies the causes and consequences of global health inequality. In 2021, Dr. Alsan was awarded a MacArthur Fellowship. So, Dr. Alsan, welcome to tonight's panel. Thank you so much for being here and taking the time to speak with us.
Thank you so much for organizing this. It's an honor to be on the panel with these other women scientists, and I apologize for being late.
Oh, no problem at all. Thank you. So our first question tonight is, how did you become interested in public health, especially global health inequality? And what were the experiences and key experiences that led you to your current position at the Kennedy School?
Well, none of it was planned. I always had wanted to be a physician. So I guess lesson number one is, be open to what reveals itself to you. I always wanted to be a doctor. I'm not exactly sure why. I grew up in a big family, and I was always kind of the one that would catch the crow that fell in the chimney that would gross out other family members. So I kind of knew that I was okay with pestilence. But then it really was after college, I had an experience working. I spent a year working in an orphanage in Tijuana. I just felt like I was burnt out. It was kind of before the gap year became institutionalized. And I worked on I didn't understand it at the time, but I was seeing the effects of NAFTA, which is the North American Free Trade Agreement, or formerly known as that. And it was essentially, lots of factories that were on the border between Mexico and the US. And a lot of families were moving from Chiapas, from southern Mexico, from Guatemala. They were moving to this border area to try and find economic opportunity, only to actually realize that they couldn't care for their children. And so I was on the receiving end, just doing work in an orphanage. And that's actually when my boyfriend, now husband, gave me this book, Infections and Inequality, which was written by Paul Farmer, who recently passed away, was really a great physician, humanitarian. And I had kind of knew that I wanted to be a doctor, but that really cemented it. He worked a lot in Haiti and in South Boston and other parts of the world delivering healthcare to the poor. And I thought, okay, this really solidifies it. I want to learn about medicine, but then kind of with this NAFTA experience in the back of my mind, I realized that I needed a little bit more in my toolkit, or I thought I did. And kind of very ignorantly, I thought, well, in order to cure sickness, you need to get a medical degree. So like a bad SAT analogy, I thought, well, in order to cure poverty, you need a PhD in economics. So that's how that came about. Clearly, I haven't cured poverty or disease for that matter. But that's where the interest and idea came about, of kind of combining those two. And the passion really came from, as your other speakers were saying, frontline experience, pivotal experiences, reading, mentorship from all different corners.
Thank you so much for sharing your experience. I especially love your comment about not always knowing about what you're going to do next. That's definitely something that I can relate to, and I'm sure many others can relate to. And so with that being said, how did you determine the next step at these times? And what advice would you give to us high school students about deciding which direction to go?
Wow. I'm so impressed with the younger women in general. So I feel just a little. I know this is a webinar, and that advice giving would be part of it, but I really do feel like your generation is just pretty phenomenal. I guess what I would say is really try and figure out what you're passionate about. I think 3 questions are, what are you good at? What do you love, and what will help others? And don't be afraid. I think, as Dr. Bauer was saying, like, even if no one looks like you, even if they need to maybe even make some accommodations because all the operation tables are for like 6'4". I mean, it's not a joke. Like, just as a total aside, one time my husband and I, he's primary care doctor, one time we were looking for like the primary care residency party, and we happened into this room where we're up, we're up to the waist on all of these big suits, and we're like, oh, we're definitely in the orthopedics party. So even if you have to, break barriers, people don't necessarily look like you, as long as you kind of check those 3 boxes. Am I good at it? Do I love it? If I'm not, great at it, can I get better at it? Do I love it? Does it help the world? And kind of keep that in mind. I think it's really important that you keep at it, because we really need kind of fresh blood. We need empathetic leadership. We need knowledgeable leadership. We need people that have, a lot of integrity. And I think your cohort, Windsor girls, this generation of girls, kids more generally, really, they have a lot of that. So it's very exciting.
Yes, thank you so much. I definitely think those 3 questions are a very helpful guiding place for a lot of people to start. So I know in your experience, you have a medical degree, you have your degree in public health, as well as the PhD in economics. So do you think in your case, the multiple degrees are necessary or recommended, I guess, to do global health or policy?
Oh, no, no. I will say this. I think so in economics, there's even this notion of just a signaling model. Like, the degree is a signal of underlying skill and things like that. So I think you can be very, very effective. And I do encourage, I think it was Dr. Mayer maybe who mentioned like getting into the clinic and things like that. I really think that, from a social welfare perspective, we have a shortage of physicians. I feel I kind of miss the consumption value of practicing, but I also think like really I should be practicing in some sense clinical medicine, because we really that training is so specific for being a physician to seeing patients, and if that isn't going to be some important part of your life, maybe again, it subsides over time, but if that isn't going to be sort of what excites you, then I really think there's so many other ways, and I'm sure many of you have explored them, of helping with our healthcare system. I know Dr. Mayer also mentioned like administrative burden. The United States has more administrative burden than any other country, any other OECD country. Our costs are 8% of healthcare cost is just paperwork. It's literally the consultants, the legal, the contracts, the coding. I mean, I'm sorry, I'm probably putting the other doctors into PTSD by talking about that, because they live that. And that's not medicine, but like, so who's gonna change that? You know, economists could change that, politicians could change that, you know, smart patient advocates. You know, there's so many ways that you can actually shape our healthcare system, make it better, make it more fair, make it more efficient. And that's kind of outside of clinical medicine. Or if you think about the importance of social determinants of health, you know, transportation, food security, having a good job, those are also key things. So who's going to make the union stronger, or who's going to, you know, make sure that moms have daycares and dads have daycares, so, you know, they can actually go off and work and their children are getting a good start. Like, all of these things are really important for health. And they're kind of not necessarily traditional medicine. So I guess you asked me if I needed all my degrees. Of course, there's some cost fallacy. This is like, after you've done it, you feel like, oh, it was worth it. I'm not totally sure. I don't know the counterfactual of where I would be without these degrees, but I definitely don't think, like, by any stretch of the imagination, you know, simply by getting a college degree, you're in an elite group in the United States more broadly. The majority of Americans don't have a college degree. So, I mean, even that is just something. So making sure you find out what you're passionate about, where you can make the biggest difference, so many ways, even just to affect health. I think it's really, really important.
Sure, thank you. And Dr. Alshan, this will be our last question for you, but what advice would you give to younger students, especially in high school, perhaps, who are interested in global health or health disparities?
Well, the habit of engagement, you know, so maybe you can't, you know, maybe you can't necessarily, and this is, I have to, you know, TM Paul Farmer, maybe you can't, maybe your parents are not excited about you potentially going to some far off place and living and working in, you know, in a poor area, thousands of miles away. But the thing about the United States is that we're essentially, and this is, you know, with apologies if I'm offending any sensibilities here, but I am also an economist, is like, we are essentially a developed economy with lots of developing economies everywhere around us. And that's just because our growing inequality, which really has taken off since the 1970s. Income inequality is just, we're now back at Great Gatsby era inequality. And so you can see that, when you walk down the street. So it's all the same, you know, humans are humans, taking care of people, getting involved, figuring out what you like, what's the best way to do it, whether it's literally in a different country, whether it's refugees in this country, or whether it's just, you know, Appalachia or South Boston or wherever it may be. Like, unfortunately, there's just a lot of need, and just building that habit and getting your brain kind of used to that. Yeah, maybe there's some neuroscience to it, but I think I think that's the most important thing.
All right.
In addition to studying, of course.
Yes, of course. All right. Thank you so much for all your answers and all your insights. We are now going to move to group Q&A. So first, I'm going to have a question for all of you, and then we'll look for some questions from attendees. So the first question for all of our speakers tonight is there anything you would have done differently professionally in your career so far? And so perhaps we can start with Dr. Mayer first.
Gosh, that's a tricky one, because it's hard to really know if you do anything differently, if things would have ended up any different. Well, I will say at this point in my life, I am trying really, really hard to be very organized. Not that I wasn't before, but I think really just trying to stay on top of things, like responding to emails, and you know, when people ask you to do things, assuming you have bandwidth for it, you do it. Not that I wasn't before, but I'm really trying hard to, um, say yes to people and try to get a lot done. I don't know if that's really the right way to answer your question, but I think we always feel like we can be doing more.
Yes, thank you. I definitely think that's a common feeling. Dr. Bauer, is there anything you would have done different in your career?
I think there's a lot of things I could have done differently, but nothing that I think I should have done differently. And I think it's keeping an open mind, the main research and clinical focus that I have is because at my first job, it was the easiest thing. So that, which is brachial plexus birth injury, taking care of kids who have nerve injuries from birth, was because it was the easiest thing that my first boss could give me to do. And she said, here, take this clinic and take care of these kids and learn about it. And that became, my favorite thing to do. So I think just having an open mind, there's maybe lots of other things I could have done.
Got it. Thank you. And Dr. Alshan, in your professional experience, was there ever a time where you would have done something differently, you think?
I think, um, yes, it's so many things. It's hard to know where to begin, but, I think, you know, either I heard this from a coach of one of my kids recently, either you win or you learn, not getting so down about failure. I mean, just sort of making I'm losing a little bit of my medicine. When your nerve cell kind of resets, making that time when you recover faster, because it doesn't do you any good. To the past is the past. You always have to be thinking forward and learn from it and just keep going. I wish my reaction time was faster.
Got it. Thank you. And I think this was a question from an attendee for Dr. Mayer. Did you ever feel imposter syndrome or out of place, I guess, whether it was at your time at Harvard or Harvard's medical school?
Well, I think the idea of imposter syndrome, it's a really kind of catchy term nowadays, and it's mentioned a lot. And I'm not sure I totally buy into it because nowadays in many of our fields, we're surrounded by wonderful, amazing, inspiring people, and it has been pointed out, increasingly more women, which is great. And rather than in that environment choosing to feel like I'm not worthy or I don't belong here, I really focus a lot on celebrating my colleagues' accomplishments. And when they do well, I'm so happy for them. And we're in a team. So, like, I'm part of it too. And so I don't really try to interpret from that something about myself or my self-worth, but I really try to think hard about the work that we do is ultimately trying to help people and trying to improve the way we take care of cancer. That's our big goal. It's not about me. And really trying to focus on this idea of celebrating each other. And that's, sometimes I'll be at work and I'll be sitting, with my colleagues, and I'll just sit there and kind of look at them and be like, wow, these are like the most incredible people. I'm so lucky to work with them. And I really feel like that's a better place to live, rather than kind of having a feeling like I don't belong at this table. Cause like you do belong, you're there. And finding a way to feel really comfortable about that and know what your place is and how to celebrate that, I think is a kind of a better way to go down the path.
Yeah, I totally agree with that. And so for Dr. Bauer, our question for you would be, how has the COVID pandemic changed the work you do, I guess, both in terms of maybe during the height of the pandemic, and what are some lasting changes that you see?
I mean, well, we still wear masks every day to go to work. I can tell you that. um, It was hard, you know. I would say that the height of the pandemic, when everybody else I knew was baking bread and moving to their summer house, we were going into work every day because the kids were still falling down, and we still, you know, it was scary. You know, you were theoretically putting your own life at risk to take care of people who needed to be taken care of. Back before we had testing, we didn't, even in the beginning, we didn't really know about masks, no vaccines, you know. It was a little scary, and it felt a little bit like we were, as doctors, I think, and healthcare professionals in general, like kind of abandoned by everybody else, you know, who was working from home. The That being said, I think some of the lasting changes have been good for patient access. So, for example, we had tried to do virtual visits and telemedicine at Children's for like 10 years before the COVID pandemic. And then all of a sudden in 2 weeks, we figured it out. And that has been really great. I see patients all over the world, you know, and I'm able to keep in touch with them. So there's a child that I operated on before the pandemic who's from Kuwait. And I kept in touch with them through the whole thing. He just recently came back for a visit because they were able to come back to the US now. And it was like greeting an old friend, you know, because we'd stayed in touch over telemedicine. And so I think some of those things, we really pushed the fabric of medicine to take better care of patients, you know, who aren't right here with us. But you know, I wouldn't do it again. Maybe that's something I wouldn't do that. I wouldn't change that. I wouldn't do that again.
Yes, for sure. All right, so our last question of the night will be for Dr. Alsan. This is also from the Q&A. So could you describe a little bit about what your weekly schedule looks like, and what, when you say like quote unquote, you're going to work, what does that look like? Are you doing research? Are you like making policies? Are you like teaching classes? Like, what does that look like?
Yeah. Well, so yesterday was a pretty typical. So I have, I'm teaching, I teach, or we could do, I teach mostly masters and some undergraduates, but also PhD students. So yesterday I taught lobbying by request to the MPP. These are masters in public policy students. And it's a core class. The first half of it, they learn microeconomics. The second class is on policy. And one of the things that I love, and this is why I really want to encourage all of you to just stick with it, find that passion, go do that thing, is because some of them came up to me, one girl in particular, and she was like, I never knew how much I loved economics. I didn't know it could be this way. Because I was really challenging them, you know, don't be intimidated by it. Ask yourself, is this really health insurance, or is this a health system? You know, and we're solving one market failure, which is that, you know, research and development generates a positive externality, which is with another market failure, which is like putting in patents and creating monopolies. So like this for them was such a cool way, I think, for them to engage with. So I think so much of the time economics is sort of, anyway, like it's a Bible that doesn't change. In fact, it's created and destroyed by people. And so that was really cool. So my last class was yesterday, office hours, couple of hours for meetings, including with a researcher from Microsoft. Then I had a call on, we're doing this project on systemic discrimination in healthcare. Then I went to see a talk by someone from U of C on estimating the elasticity of demand for firearms. And then we had a dinner. So it wasn't totally intern hours, but I think it was like a 7 to 9 day yesterday. So that's kind of, but it is much more flexible, I would say, than, you know, than at least internship, residency, fellowship. Attending is, you know, has a lot more flexibility in terms of like setting your schedule and stuff. And then academia has more flexibility when you're not necessarily teaching. So outside of like just like a another, like another form of teacher.
Yes, that makes sense.
Not too much information. I should
Oh,
have my
no,
Google Calendar open.
that was great. Thank you so much. No, that was super helpful. So that was a lovely responses from all our panelists.